Okay, so today we're going to cover drug treatment and prevention for the drug use and addiction class. I'm going to explain how I got some of this information for the prevention side of things. But first, we're going to cover some principles of effective treatment for treating drug use. So, the number one thing is that we have to remember that addiction is really complex. It's a disease, but it's treatable, and it's a disease that affects both brain function and behavior. We have to consider these elements when we approach treatment technique because it is not a, one size fits all single treatment that's going to be appropriate for every single person everywhere. We have to consider, for example, situation. We have to consider who the person is. If they are a parent, a single parent, if the person is older or younger, an adolescent, an adult, we have to consider who the person is and what the situation is in order to have an effective treatment plan. Number three, treatment needs to be readily available. You need to have options for people, and they need to be able to go to a treatment or take part in a treatment that does fit their needs. Number four is that, and this is related to both 2 and 3, that the effective treatment has to treat and attend to the multiple needs of the individual, not just the drug abuse itself. So here we're talking about potentially medical, psychological needs, social, vocational needs. If the person has legal problems, for example, that needs to be addressed, and potential counseling for those issues, as well as looking at the family element. For women, for example, there are biological, social, and environmental differences that can impact motivation. So are they financially independent? Are they pregnant? Do they have children? What's the child care situation? So it can be different based on male or female or trans. It just depends on the person's needs and situations. We really have to look at the individual's age, gender, ethnicity, and culture so that we can make sure that that treatment is going to attend to those needs. Another thing that we can do to reduce the treatment gap is by increasing access to effective treatment. Looking at, making sure that insurance can cover it or can cover the majority of it, reducing stigma, as well as raising awareness among patients and professions of the value of addiction treatment. We want to make sure that people know that this is important and that this is something that, when used correctly and when it tends to the needs, is in fact effective. And one other principle that we talk about in terms of effective treatment is that the person really needs to remain in treatment for an adequate period of time. And that is really critical and crucial to effectiveness. So most individuals who are addicted need at least 3 months in treatment to significantly reduce or stop their drug use. We find that the best outcomes, of course, are with the longer duration treatments. But there are several things that we have to consider in this process. So the person, really needs a motivation to change their drug using behavior. There needs to be support from family and friends. There may be pressure from the criminal justice system or child protective services. And employers and families really need to all help the individual stay in treatment. So sometimes that pressure from the criminal justice system and pressure from child protective services can be enough pressure to get the person to stay in treatment. And there is a sort of a thought that is kind of erroneous, is that people who are forced into treatment drop out and don't do as well. And it turns out that people do, in fact, do well in treatment when court ordered to do so. And they do tend to have very good outcomes compared to those who maybe check in themselves or are motivated from the beginning to change their behavior. A few other principles. So number 6 is that behavioral therapies are the most commonly used form of drug abuse treatment. This includes things like individual, family, and group counseling. They tend to help people improve communication, help them improve their relationships and parenting skills, as well as improve the family dynamics of the situation. Therapies can really motivate people to participate in drug treatment. They can also offer strategies to help with coping with things like drug cravings, helping people avoid drugs and prevent relapse by giving them the skills and tools that they need to do that. And then if relapse occurs, how to deal with this. And I want, this to be very clear about relapse, is that a relapse doesn't indicate failure. It just shows that the treatment either needs to be reinstated or readjusted for that person's needs. And if everyone who went into treatment saw relapse as an immediate failure, then, nobody would be on the path to, recovery. It's just something that is, that does happen. And so it needs to kind of be addressed and then, move on and say, okay, how can we adjust this? How can we better suit this treatment for this person's needs? For a lot of people, medications are an important element of treatment, especially when we combine this with counseling and other behavioral therapies. There is a process of medically managed withdrawal, and that is something that can help people who are experiencing withdrawals from, for example, heroin or opioids. You can use methadone, naltrexone, for example. For alcohol, naltrexone is also used, anti-abuse is used. These are all medications that can help with those really difficult symptoms that one experiences when they're withdrawing from a particular medication. And this should not be stigmatized. If a person needs this for the temporary purposes, then that's something that you need to consider for the person. So just to kind of give you an example, the average cost for a full year of methadone maintenance is about $4,700. And so if you consider that a full year of imprisonment is about $24,000 per person, it's a much more cost-effective way to manage recovery and manage withdrawal maintenance than to incarcerate the person. So there is a big stigma against using medication to help with recovery, but remember that it's not a singular thing. You don't just use the medication and then try to cure the person. It needs to be coupled with therapy and counseling and other behavioral therapies to allow for the person to experience a really secure road to recovery. Number 8, an individual's treatments and services plans needs to be continually assessed and modified as necessary to make sure that it meets the changing needs of the person. Just because you walk into a particular treatment or a service plan doesn't necessarily mean that that particular plan is going to suit you 100% the entire time. So in addition to counseling or psychotherapy, a person might require medication. They might require medical services, especially if the person relapses or if the person has a comorbid disorder or disease. Person might need family therapy, help with parenting, vocational rehabilitation, or other kind of social and legal services. And so you need to make sure that that treatment plan is continually assessed because the person's needs might change as they are on a particular treatment plan. Number 9, many people who are addicted to drugs do have other mental disorders. Not everybody does, but there are a percentage of people who do have comorbid disorders that can exacerbate drug use, and those needs need to be addressed. And so if a person goes through a treatment plan and they have a particular mental disorder. Maybe they have bipolar disorder, or if they have major depressive disorder, or they have schizophrenia, any kind of range or severity of disorder, that also needs to be managed, because the withdrawal process might impact their symptoms of their pre-existing condition. And that really needs to be addressed because it can impact recovery. Number 10 is this medically assisted detoxification is just the first stage of addiction treatment. By itself, just detoxing the person and getting them through the initial stages of just getting the drug out of their system is not going to change long-term drug abuse for the person. It does very little to actually change behavior. All it does is kind of help them into that first stage. So things like motivational enhancement, incentive strategies, and you begin this at initial intake, that can improve treatment engagement, that can help the person stay on track and stay with the treatment program. That first initial detoxification is just to get the person basically started on the recovery process. I have about 3 more points here for principles of effective treatment, and then we'll talk a little bit about some of the treatment options in the local area. So I was kind of alluding to this earlier about the fact that treatment does not actually have to be voluntary to be effective. If you look at sanctions or enticements, for example, from family members, from employers, from the criminal justice system, these all can significantly increase not only treatment entry, so the person going into treatment, it can improve retention rates and ultimately the success of drug treatment interventions on individuals with drug abuse. It's kind of a myth to say, well, you need to want to change to get into a treatment program. And that's actually not the case. The research shows that even people who are forced into treatment, whether it's by an ultimatum given by a family member, if you don't do this, I'm going to leave, or I'm going to, divorce you, or I'm going to, disown you, or whatever it might be. If you give a person an ultimatum, or if the criminal justice system says, if you don't do this, you're going to go to jail, or the Department of Social Services might say, well, if you don't do this, we're going to take your children away. That is enough to get people motivated to get into programs, and we often find it to be very effective in them finishing the program as well. And so that's a stigma I believe a lot of people have, that, you have to want to change to get into the program. And if you have a really good treatment program, you often find that may not be the case, that person can still come out of recovery and do very, very well compared to those people who sort of self-check in. Number 12, drug use during treatment must be monitored continuously. Relapses during treatment do occur. And so we do have to consider that this is a possibility. And so, a really effective treatment plan might look at doing random drug screens or drug tests once a week to monitor, to make sure that the person is not using. And again, this kind of stems back to an earlier point of the treatment plan has to be catered to the person, and they have to make sure that it assesses the needs and changes as the person goes through the recovery. And then finally, treatment programs really should test patients for infectious diseases, for example, HIV or AIDS, hepatitis B, hepatitis C, tuberculosis, and other infectious diseases, as well as provide targeted risk reduction counseling. And in some cases, this might be linking patients to treatment for those infectious diseases, especially in cases where needle use, might be something that the person did. You would have to assess them to make sure that they don't have any particular infectious disease that they might have acquired during perhaps unsanitary drug use. And, or for example, if the person was engaging in other risky behavior while they were using drugs, for example, unprotected sex, that might be something that you would want to test the person to make sure that they are getting their medical needs assessed and taken care of during this recovery process. So those are the principles that I wanted to cover when it comes to drug use. And what also I want to cover here is just some of the types of treatment programs that are available and have been shown to be effective in treating drug use. So we're going to talk about three major ones. We have the long-term residential treatments, the short-term residential treatments, and the outpatient treatment program. So we're going to kind of walk through these and some options and how they're used. So when it comes to the long-term residential treatment, the best known treatment model is the therapeutic community, or TC. Now, this particular kind of treatment program, the long-term treatment program, focuses on resocialization of the individual. And so in this case, relies on residents, staff, and social context to get the person basically back into the system, okay, back into society. These programs last anywhere between 6 to 12 months and tend to be the most expensive treatment options that we have out there. And that is because they are, up to a year, and the person is living at the residential treatment facility, and it does require, for some people, round-the-clock care, depending on the stage of recovery. For short-term residential treatments, this is about a 3 to 6 week hospital-based inpatient treatment, and it's followed by an extended outpatient therapy. This last part, this extended outpatient therapy, is really important in reducing relapse, because the person is only staying in the hospital, for up to 6 weeks, and we, really find that the recovery tends to do better. Relapse is avoided more so when the person also then moves into an extended outpatient therapy. We also see that in the short-term residential treatments, following up and participation of like a self-help group, like for example Alcoholics Anonymous, AA, or Narcotics Anonymous, for example, really does help with the recovery road here. And then finally, we have the outpatient treatment programs. And I've split these into two. But the outpatient treatment programs is a low-intensity program. It may offer basically drug education, but not much more than that. It just depends on the quality of the program. Group counseling is usually a major component of these outpatient treatment programs. And so an individual drug counseling program is usually something like a 12-step participation. Person has to attend 1 to 2 times per week. And referrals can be made for medication, psychiatric help, employment, other services. And so it kind of links them in and networks them to services that they may need. The other portion of this is group counseling. And this is where the recovery plan is trying to be more community friendly. The important thing for group counseling is a bit of standardization. We often find, too, that cognitive behavioral therapy, or CBT, is used for group counseling as well, and we'll talk about that in just a minute. So that's pretty much the major types of treatment. There are definitely other ones that are split into here, but these are the most commonly used ones. Now, there are 4 behavioral therapies that we're going to cover just here in this lecture. The first one is cognitive behavioral therapy. And the way that this works is to try to get the person to reform how they think about things. And so cognitive behavioral therapy, or CBT, is changing the way that you approach your abuse and your behaviors, and trying to retrain the brain into thinking of different perspective in different ways. So for example, it can help with rumination. So if you're depressed and if you're thinking the same thought over and over and over again, CBT helps to kind of cut that and try to get you to think on a different track. CBT is mostly used for recovery from alcohol, marijuana, cocaine, methamphetamine, and nicotine. These are not the only kinds of drugs that it's used for in terms of recovery, but these are the most common. The next one is motivational enhancement therapy. It uses motivational interviewing, and these principles are used to strengthen motivation to get the person to stick with the therapy and build a plan for change. And this process aims to evoke rapid and internally motivated change rather than sort of stepwise. We're going to do step 1, step 2, step 3. This is more of like, okay, we are trying to change your motivation tactics and get you, less motivated to use drugs and more motivated to engage in your career or in your family. Trying to get people to stay motivated, to stay clean. And it's one of those things where it's designed so that it's the person who is initiating this, and the person, the person who's going through recovery is the one who sort of takes responsibility and says, I am motivated to change. And so those are the principles that's used with that. It works really well for alcohol and marijuana. The results are sort of mixed for things like other drugs like heroin, cocaine, and nicotine. It's also a bit mixed for adolescents who use multiple drugs. But there are definitely techniques that are they're still working on designing to improve those results. It's more effective for engaging drug users in treatment than for producing changes in drug use. It's trying to get the person focused to stay in the treatment plan and to keep with the program. We often see motivational interviewing used for trying to modify health behaviors. Like for example, if a person has diabetes and you want the person to improve their diet, motivational interviewing can be helpful in getting them on the right track. So that's something that's also used in this scenario. The matrix model is most successful when used for people who abuse stimulants. It's at least a 16-week model, and the treatment materials draw heavily on other tested treatment approaches, and it includes elements of relapse prevention, family, group therapies, drug education, self-help participation. There are individual sessions. They have family education groups. They have early recovery skill groups to build the skills to make sure that the person sticks with the program. They have relapse prevention groups to help with the process of cravings and relapse potential. There are combined sessions. There are drug testing involved in this matrix model where they have urine tests to monitor drug use. Also includes things like 12-step programs, analysis of relapse, and social support groups. So this matrix model has a lot packed into it to help with that treatment process. And then finally here we have the 12-step facilitation therapy program, which most people are pretty familiar with, this 12-step program. And it seems to be most effective with alcohol, stimulants, and opioids. It's not effective for everyone, but it is something that that a lot of people do put a lot of value in. And it kind of revolves around 3 major things: acceptance, surrender, and active involvement. And so you'll see that a lot of times this program has mentorship and has people who help establish connection and relationships. This is something that started out as, primarily having religious affiliations, and not all 12-step programs do that. But that's kind of where it sort of started. Now, the last thing of this part that I want to talk about is just a few local treatment centers. And so this is very specific to Southwest Virginia. So looking at Tennessee, Kentucky, Virginia. This information, Dr. Christina Fieser provided to me a couple of years ago. So it might there might be 1 or 2 more facilities that are available, but I don't believe there's anything that's been really established since this information. So just kind of, and you guys can sort of peruse this. The problem is that while we might have detox available and some residential treatments within relative driving distance, in our particular area, there's really not a lot of treatment options, and that's very unfortunate considering we're in a location that has basically an opioid epidemic. You would expect to have some really high rated facilities that people can go to. And, it is arguable that, going to a facility that's not in your backyard is better because you are, really needing to kind of get away from the scene, and you need to really get away from the area and remove yourself from the environment. So, that's one thing, but it is surprising that we don't have more options. So this is some detox options. We have some short-term residential clinic options in Kentucky, some in Kingsport, as well as other options here. There are some dual diagnosis services that can be taken advantage of. So Clintwood, Big Stone Gap, for example, and some areas some in Kentucky and Clintwood. There's a few outpatient options relatively near-wise, but still within driving distance, nothing that's super close. And again, a lot of these are in Kentucky, Clintwood, Big Stone Gap. And then a few long-term options that are relatively close, Kentucky, Kingsport, Tennessee, for example, that are not necessarily for some people within driving distance. If you don't have if you don't have transportation, it is very difficult. And then finally, some inpatient facilities. We have some in Kentucky, some in Tennessee. Most of these, inpatient residential clinics are not near wise, and so that makes things even more difficult for people who are trying to get help, especially in this particular area, because they do have to travel significantly from their home, and that can be very difficult to do given certain family situations. So I'm going to end the lecture here and then pick back up on prevention. We're going to talk about some principles of prevention that are separate from treatment, and I'll tell you guys the source for most of this information, which comes from a particular National Institute on Drug Abuse, a research-based guide. So I'll pick back up on this, and you guys will end with basically, we're going to talk about some prevention technology from this particular lecture. If you have any questions, you can email me, and we will see you on the next one.